Hi, welcome to Pull-Ups Pasta Politics. We're going to go live today. We're going to be speaking with Congresswoman Katherine Clark. So I'm just going to go ahead and invite her here to respond. We're going to be speaking to Congresswoman Katherine Clark today. Hi.
Hi, how are you?
I'm good. How are you?
I'm all right.
I'm loving the art behind you.
Oh, thank you. That's my district. Those
I
are all my towns.
That's so great. Well, Congresswoman Clark, thank you so much for being here and also everything that you do. I have so many questions for you. I could probably talk to you for hours, but one of the things that's interesting is that you're already on vacation, summer vacation, early because Mike Johnson decided to send everybody home rather than release the Epstein files. So
That's
you
right.
tell me anything about that, or?
I mean, what a crazy choice.
I
But completely consistent with everything we've seen from House Republicans and Donald Trump. This is all about protecting the very wealthy, the very connected, the very powerful at the expense of folks at home. So we are going to use our extra days of recess to get out there and talk to our neighbors, listen to our constituents, and not only explain what has happened to them in the last 6 months as far as their health care being taken away, veterans benefits, food programs, funding for public schools, all to give a tax break to the very wealthiest Americans while running up our national debt. But that we also, as Democrats, we have a very different vision. And it is grounded in that people at home deserve better than they're getting. And they deserve access to health care. They deserve to be able to have a lower cost of living and lower bills. And they deserve to take on corruption in Washington and make sure there is a government that is putting them first.
Yes, absolutely. I know that some of the things that have come up that I've spoken to a lot of my followers and people, my family, friends, about a lot of these cuts that are in the, big awful bill. So I think I know the answer to why they're doing some of this, but wanted to also have you just expand on that. So I know that the cuts to Medicaid, they've added these work requirements and cost sharing factors. How is that going to affect women who are, especially low income women, coming next year?
Yeah, Robin, thank you for highlighting this because the impact on women is really going to be terrible and pronounced. Right now, 40% of all births in this country are funded by Medicaid. And we know that, we are already seeing such a impact, especially for women living in rural parts of this country, that a third of all our counties don't have an OBGYN right now.
Yeah.
And so while we have, Charlie Kirk saying you better go get your MS degree, you've got
Yeah,
JD
I love
Vance
that.
saying just have more babies. We
Yeah,
don't even want to provide them coverage to have a baby safely and
yeah,
be able to go to a doctor, never mind make their decision
yeah,
about if and when to have children. Like, let's put that one
yeah,
aside.
yeah. Even that, even the women who want to have children,
Even the women who want to have
yeah,
children, or
that,
it is so outrageous what we are seeing, and the impact on women is really, it is going to be devastating.
yeah. I was talking about this today, how in some of the areas that they want to defund, like even Planned Parenthood, you can't even end your pregnancy in those states anyway. So they're just denying access, to OBGYN care. They're just denying access to cancer screenings. I mean, you're already, so it's really kind of insane what they're doing over there.
It's
One of
insane.
the other big cuts, and I talked about this a lot before the bill was passed, but I think a lot of people didn't know it. It's just recently come out about the extreme cuts to the ACA.
Yes.
I'm
Yeah.
a business owner, and my family, we get our health insurance from the ACA, and I belong to a whole network of like mom entrepreneurs, and There's a lot of women who have been getting their, health insurance through the ACA. And in my state, we get about 85% of the subsidies come from the federal government. So I looked, my insurance is going to go up like $15,000, $20,000 a year. So some people have told me between that and the tariffs, they may have to shut their small businesses and go back and work for large corporations just to get the health care. And
That's right.
so I'm wondering, like, is that an intentional move on their part to destroy small businesses? What are your thoughts on why they're doing that?
You know, whether it's their intent or not, that is exactly what's going to happen.
Yeah,
And I am truly sorry that you, like so many entrepreneurs, are finding yourself in this situation. As I talk to small businesses around the country, they are so worried that their doors have already virtually closed,
yeah,
but they're going to be able to keep going for a few more months. A lot of that driven by the very high costs when they had to purchase goods for the holiday season, which for many small businesses is their absolute lifeblood. Those are the profits that keep them going the rest of the year. But of this issue of the ACA
yeah,
is one that just shows how corrosive this whole big ugly bill is.
yeah.
We're talking about 5 million people being impacted, and every single one of us, no matter where you get your health insurance, is
Mhm.
going to end up paying more.
Yeah.
But specifically, a family of four making a $90,000 income are
Mhm.
looking at a premium increase of 70%.
Yeah, it's huge.
70%.
Yeah, and it's interesting because we're people who are like we're working, we're paying for the healthcare. It's not like we're not paying into the system. And whenever I go to the doctor, I still have a copay, I still have a deductible, I still have to pay for my prescriptions. So it's not like it's just this free ride that people are getting. Going after the ACA is just I don't think a lot of people expected it.
That's right.
Because it's sort of a back door in getting rid of the ACA. And I just know so many people who, like, in my town, like my husband goes to a hairdresser and she is one of those, like, they have this new style where like all the hairdressers just like rent a space instead of working for a big corporation, so these women can make their own hours and work around their kids' schedules, and they get their insurance through the ACA. So do like the Uber drivers. I mean, there's so many people in our community that are going to be affected by it that don't even know it yet.
That's exactly right. And those notices are going to start to come out in September.
Yeah.
So as we are seeing people going back to school, it is going to be increases in not only the price of clothes and shoes and small electronics that people rely on because of tariffs. It's also they're going to be receiving these premium increase
Yeah.
notices. And, you know, we are already making it so hard. 60% of all households are saying, I can't afford the basics right now.
Yeah.
And what this bill has done, what this administration has done, is promise to reduce cost of living on day one and worked every day for the last 6 months to do just the opposite.
Yeah.
And I feel like this summer is a time where we're still sort of all these cuts, the increase in prices
Yeah.
for basic goods are still sort of holding,
Yeah.
but the bottom is about to drop out from underneath people.
Yeah.
And
I'm noticing it like in the grocery store. Like I do simple calculations. Like all of a sudden I was like looking at what we pay for coffee. And I'm like, I told my husband, I'm like, do you realize we're going to spend $500 more next year for coffee? And
right,
I'm like, and and we'll make adjustments. Maybe we'll buy less expensive coffee or whatever it is. But like when you start to do that to every single little thing, I'm like, this
that's
this
right.
is in a really bad situation.
It's
I
a really bad situation. And we're already seeing, if you just take one large chain store,
Yeah,
Walmart, the price of coffee has already gone up so much. The
yeah,
price of buying new pans is up sometimes 150% already.
yeah,
Just these little items that really add up for people.
yeah. It's crazy.
it's, it's our message to people at home that you deserve better than this. You
Yeah,
deserve better than this. And we have to go out and make that case, not only explain to them exactly what is going on, that this administration is about the very rich, the very powerful,
mhm.
full stop. Full stop. You're
Full
not in their
stop.
calculation. And for a party that says they are supporters of small business and recognize that they are so key to our economy, they are just undermining their ability to have health insurance, to
Yeah, I work
have,
at the
uh,
NRA, Retail Federation, and I've had many calls with,
yes,
and they've encouraged us to. They're like, we don't want to make this a partisan issue. And I said, but the Republicans won't meet with us. I've tried. I've tried to talk to them about, making carve outs for small businesses and things like that. And so it unfortunately it is partisan. The Democrats are the only ones that are like working to try to help save small businesses, which for women especially are
right.
fine. I know so many women who got their financial freedom from being able to start a small business. They were able to get out of bad marriages, things like that. It's just devastating. One of the other questions I had for you, though, was on this Rescissions Act, where
Yeah.
there's $500 million from the Global Health Fund. And there's some carve outs, but they are specifically not putting any carve outs for reproductive health or family planning. And these are areas where, like, women are living in, there's high poverty, there's civil unrest, there's food insecurity. Why you would take away family planning from those areas just seems cruel.
It is cruel, and
Yeah.
it's just this obsession with Planned Parenthood,
Mm.
and is just one dynamic of this. But Planned Parenthood, 96% of the services they provide have nothing to do with abortion.
Yeah.
And they know that abortion hasn't received federal funding in decades. In
Yeah.
decades.
Actually preventing abortion.
But
Yeah.
they are, when they say that you are no longer able to get, however severely reduced Medicaid,
Yeah.
Medicaid funds, they are going after exactly what you're talking about.
Yeah.
People where Planned Parenthood is often the only access to health care.
Yeah.
And yet they're saying those cancer screenings, contraception,
All of that.
fertility treatments, none of that is going to be available to you
Yeah.
because we are obsessed with closing Planned Parenthood.
Yeah.
And
I
so what,
remember in high school, there were so many girls that, like, they weren't fortunate enough. My mother was like, if you need birth control, we're going to get you birth control. But I knew so many girls that were living in homes that were so strict, and it wasn't going to stop them from doing things, but they needed to get the birth control. And Planned Parenthood was such a safe place to go because they didn't just hand you the birth control. They made sure that you were healthy. They made sure that you knew what consent was. They made sure that you
right.
understood that birth control didn't also protect you from STDs. Like, it was such a positive place. And I remember going like with friends and just feeling really comfortable about it. And it gave us a safe place to discuss, to make sure that we knew that like what we were doing, that we had consent for it. And it's just a rippling effect for women to understand that we should have control over our own bodies, our own financial freedom, because women get pregnant and then they have to drop out of school or they can't work. So I just remember, that was a long time ago, but it's just really important.
And
What
it continues today. That is just a story of people who go to Planned Parenthood because, just like you said, it is affordable, it is quality care, and it's a safe place.
Yeah.
And, I heard stories just recently about someone who had a cancer screening at Planned Parenthood that picked up cancer early. So
Yeah.
she was able to get the treatment. If we cut people off, whether it's Planned Parenthood or Medicaid or making the ACA too unaffordable, too high cost for people, it's not like people aren't going to get sick. They're
Yeah.
just not going to be able to get care. And they are going to arrive in emergency rooms much sicker
That are
than
all.
they were. And it will continue this spiral of driving healthcare costs. And so all of this just sort of leads back to the question that you asked, like, what is this intentionally like going after women's health? Is this
Yeah.
intentionally going after our small business community? Like, what is the story? Because it is so hard, I think, to take in the full support for Donald Trump, no matter what it means to people that have elected you to represent them.
Hmm.
It's just the key measure on why you vote for something is that it will make Donald Trump happy.
Yeah.
And that's the end of the calculation. And that is a very dangerous place for a country to be in with the Republican Party.
Yeah, I know when you mentioned things about, this is the biggest transfer of wealth. I don't think people understand just what this transfer is going to mean. And I know it's going to take a while for some of these things to be implemented, maybe starting next year, but it's really going to be devastating. And so, what do you think that we should be doing? I mean, I talk to my community. I talk to people about creating support where you live right now. Unfortunately, some of the things that have happened, we will have to live with at least temporarily. To create community, to make sure that you're reaching out to not only give support, but to receive support. Some people have trouble with that. And I know that we have the midterms that will come up, and hopefully we can make some changes. But do you have any other advice on what, women just should be doing in their everyday life?
I think, what I would say to your listeners and followers is that your voice is the most important voice in all of this conversation.
Yeah.
There is nothing that people trust more than hearing from a friend, a family member, a neighbor, someone you go to worship with, someone you work with. Those are the voices that people trust. And when you are laying out what is coming their way, it rings very differently than when I say it or
Yeah.
any other politician says it. And it is so important that people understand it. People lead very busy lives. They are not following politics and the different steps. And we have to help them connect the dots. Because unfortunately, we are going to see these effects, even though this bill is completely designed to put off the worst effects until after the midterms
Yeah.
and then after the next presidential election. But
Sure.
we are going to see those ACA premium
Yeah.
increase notices going out in a few weeks.
Yeah.
We are going to see that states are going to start deciding on their Medicaid policy. We are seeing hospitals already that are saying, looking ahead, we're not going to make it and we're going to close now. I recently did a tour of rural hospitals in Mississippi,
Hmm.
and every single hospital we went into was terrified of these cuts, but
Hmm.
none of them had a labor and delivery department. None
Oh,
of them. And
so
they
no,
said women
when you're
come
pregnant, you want to know how close that maternity.
right.
Because
And
you don't know how quickly that
it's
first baby's going to come.
it's just not okay.
No.
It's not okay that we're
No.
saying if you are, and never mind, where do you go to get good prenatal care?
Oh, I
And
know.
so this is so interconnected.
Yeah.
And what we are just seeing is an administration that is willing to give up all of this. And that, you brought up this huge transfer of wealth. It's kind of hard to take in because
Yeah.
you hear parts of the bill and it's like maybe I like the idea of not having reduced tax on tips, maybe
Which is,
reduced tax on overtime, and we can have a conversation and let's have it about a tax code that is centered around working people.
yeah.
But the sleight of hand here is
Yeah.
that those are temporary and small,
Hmm.
and what's permanent is for the 0.6% of Americans, not even the top 1%, the
Yeah.
0.6. And it's insane what we are doing. And it is just the fact that they are so willing to cause this upheaval in our small businesses for families at home, that are struggling to pay a child care bill. And now they're being told that their nursing home where their parents are is going to close. And where are they going to come? They're going to come back to their families.
Yeah.
And they're going to be asked to do even more with even less. And so it is really that power of connecting, that what seems to be a lot of fighting in DC and
Yeah.
maybe people feel doesn't involve them. It is up to each of us to make those conversations clear so that people know what's happening and that they can get and support people who are going to make a change and go in and fight for them.
Yeah, I agree. I mean, I just think that not everyone's in tune to the news every day, all the time, and so I do try to give those tidbits of things so that people
Yeah,
can pass them on, so they know what to expect. Because that's, I know, especially when I was raising like a little kid, it was, I was very much distracted, didn't know what was going on, and then all of a sudden you see a big change happen. And so I do encourage people whenever they see something, make sure it's valid and then share that information in your everyday
right.
life. Because, I just know that when I speak to somebody directly and I explain to them, this is what's going to happen to my family. Or recently we went through this, my mother's cancer and trying to find a nursing home that was adequate. And I tell people, I know you haven't gone through this, but it's not a joke. Like, there is a problem with the Medicaid in this country and getting adequate nursing care. And it cost us $20,000 a month to take care of her at home because we couldn't find a facility that was, nice enough to take her. So when I tell people those real stories and how it really impacted our family,
Yeah.
they do listen then, and it changes minds, and it activates people to maybe get out and vote, or make sure other people in their family get out and vote, stuff like that. So that is great advice. I appreciate that.
Yeah, and Robin, thank you for sharing. It's not always easy to talk about,
No,
like,
but
how
I've learned.
things are falling short for us and for our families.
Yeah,
And it is, I remember when, my mom had Alzheimer's, my dad had a debilitating stroke, and I had three school-age children. Like, none of it was easy. And I
yeah,
have a lot of advantages because I do have health insurance. I have a job that I can take paid sick time. I have that kind of flexibility. For so many families in this country, they don't have that. They don't have it. And it is not okay that with this president's budget, with the policies they're putting in around tariffs and impact on pricing, what they are doing to take away health care from people and our veterans and our public school funding, that we say that's okay as long as the very wealthy are doing all right. That cannot be the priority, because there's no place over time that even the wealthiest person
yeah.
can really be untouched by this. And so we have to reclaim that power.
Because it doesn't work. So many people are struggling and don't have health care and don't have jobs and don't have food. Like, it doesn't help to be at the top when everything's falling apart either.
That's right.
Totally get
That's
it.
right.
Thank you so much. I really appreciate your time. I know that you're busy and I have a lot that you're working on, but I really appreciate you talking to us today. And I hopefully I can meet you when I'm in DC next.
I would love that. Thank
Yeah.
you so much, Robin, for having me on, and thank you for really being a voice for so many people out there who are
Yeah.
trying to find their way in this
I go
complicated and
crazy if I
challenging
talk.
time.
So, yeah, so I appreciate it. But thank you so much.
All right.
Enjoy your weekend.
Yeah, you too. Thank
Okay.
you.
Thank you, Catherine. Bye bye.